Good afternoon, all. Thank you for joining us today. My name is Sarah Wallace. I'm on the right there. I'm here today with Karen Anderson.
Hello, everybody. I'm on the left. Good to be with everyone.
Yes, we're very excited today to talk about retirement and Medicare. Karen and I both work for AAA. We are independent brokers that AAA brought on staff to help our community understand this really complicated coverage. It's not easy. Everyone's health journeys are different. So we are here to help you understand what steps to take when and to sign up for any plans that you may need if you do need them. Another thing we can do for you is we can compare the different options in your area to make sure you understand the differences in the plan and what will cover you the best for, again, your specific health journey. So today for retirement, we are going to go over the timelines and enrollment periods that come up with retirement, Medicare and retiree insurance and how they work together, and we'll finish off with your responsibilities and how to move forward. The first thing we're going to ask ourselves, of course, is when are we retiring? If you're going to retire under the age of 65, you are responsible to find your own health insurance until you're eligible for Medicare. This could be under a spouse's plan, off the marketplace, but it's your responsibility until you're eligible. If you're going to retire right at 65, you are, of course, eligible for Medicare, and it may behoove you to sign up for it. You are going to want to identify the coverage your company offers as a retiree and how long it lasts after you retire. You're going to need to know when your employee coverage ends. And if you're not going to retire for a while after your 65th birthday, specifically 3 months or more, as long as you have creditable coverage, you do not have to sign up for Parts B and D. You are going to make sure at the age of 65 and every year thereafter that you do have creditable coverage because you're going to have to prove it when you do go to sign up at the time of retirement. So every year you delay Medicare, you'll need this proof of coverage, which is usually provided right by your employer either annually. AAA sends theirs out in an email, but I do know some companies actually mail out the letters still, and it will just say you have creditable coverage for health insurance. And a piece you really want to remember is also that Part D prescription. So once you identify when you're going to retire, then you can kind of understand what enrollment period is relevant to you. So everyone says you have to sign up for Medicare right at 65, and that's not always the case. What they are referring to is what is called your initial enrollment period. This is a 7-month window that starts 3 months before, includes the month of, and goes 3 months after your 65th birthday. So if you are retiring anytime within this window, you're going to be using your initial enrollment period to sign up for Medicare. If you're going to keep working after 65, it's okay that you don't use that initial enrollment period as long as you have proof of creditable coverage, you're good to go. When it's time to retire, that's going to trigger what is known as a special enrollment period. So retirement has its own enrollment period at the time, either the day you retire or the day your health coverage ends, whichever is first. So from this date, your date of retirement or the day your health coverage ends, you have 8 months to sign up for Original Medicare. Now, Original Medicare does leave you up for some risk. So what I really want you to remember is you have 3 months from your retirement to enroll in a Medicare Advantage plan, a Medicare Supplement plan, or a Part D prescription drug plan. So they do give you 8 months for original Medicare, but you want to make sure you have comprehensive coverages. You don't want to leave yourself open to any risk. You're going to want either an Advantage plan, a Supplement plan, or a Part D plan, and you only have 3 months to sign up for those. Let's talk a little bit about the different pieces of Medicare. We could spend a whole hour on this slide. However, we're going to keep it very high level just so we're all talking the same language. If you do need more information, we have a monthly seminar called Medicare 101 that you can attend, or you can call us. We can have this conversation one-on-one with you, ask specific questions, answers any scenarios you're working through. Some people don't have that retirement date nailed down, so they, want to talk through the different options. So going into the different pieces of Medicare, original Medicare, again, is Part A and B. And Part A only pays for your room and board in the hospital. Part B is what covers your medical insurance. So it only covers 80% of your medical costs, leaving you up to a 20% risk. Now, 20% of a doctor's appointment is not that bad, but 20% of a hospitalization is, and you can get hospitalized for anything these days. I'm thinking broken bone, respiratory illness. Like it does not take much to make that 20% risk very, very scary. So in order to cover yourself for that 20% risk, that's where that Medicare Advantage or supplement plan will come in. These are provided by private insurance carriers and they cover your 20% risk. So they work with Original Medicare to give you comprehensive coverage. There are some big differences between the two. They are very good options. Depending on your health journey will depend which one you choose. But what we're going to focus on today is the Advantage plan usually includes your drug coverage, where your supplement plan means you'll have to pick up a separate Part D plan. And that's okay. We can help you find that out. Again, they're both very good options. It just depends on what you want out of your retirement. Talking about prescription drug coverage, this is Part B Part D is in dog up in the right-hand corner. This is a government mandated level of prescription drug coverage that all individuals over the age of 65 must maintain. So they're going to want to know if you're working past 65 that the employer coverage you have not only gives you creditable Part B, but creditable Part D prescription drug coverages. More and more, I'm finding group health plans that do not have a creditable level of prescription drug coverages, and we can help you shore that up. We don't want to see you risking any penalties for Part B or Part D. So moving on from Medicare, there's another insurance offered to retirees, specifically retiree insurance. Not every employer offers it, so it's important to ask your company what they have for you at retirement. Does your employer offer health insurance after you retire? How long does it last? What are the costs and coverages? Will you need a supplemental plan to make sure you have full coverage? How does the retiree insurance work with Medicare when you're eligible? Is the plan considered creditable for Part B medical and Part D prescription? These are very important questions. Only your benefits coordinator can answer them, but we can help you understand their answers. So once you get if they offer a retiree insurance, they'll give you a benefits summary. You can bring that to me or Karen, and we can walk you through what's covered and where you might need extra coverage. How does Medicare and other coverages work together? Well, some of you might actually experience this already. If you have multiple insurance plans, each is designated as a payer. Your primary pays first and only pays up to the limits of its coverages. It's only going to pay for those medical needs that are covered under the plan. Your secondary will pay if there are any costs the primary didn't cover and only if those extra costs were covered under their specific plan. So that secondary still may not pay all of the undercover costs. They're only going to cover what's within their benefits summary. So who pays first? On the screen there for you, are a couple of good benchmarks of who would pay first in different scenarios. So working my way from the top to bottom, if you are going to continue working after 65 and your company has 20 or more employees, usually your employer plan is your primary payer and Medicare becomes your secondary payer. If you are currently working and your company has under 20 employees, Medicare will be your primary payer, with the employer plan being that secondary. So in this instance, it's very important to make sure you sign up for Medicare to make sure your employer plan pays out correctly. So if your employer is your secondary payer, you may need to enroll in your Part B Medicare. If you are under a retiree insurance plan, Medicare is usually your primary, with the retiree benefits being your secondary. And if you are on COBRA, Medicare usually pays first, with COBRA paying second. So this is where it's important to understand who's paying your bill when and what level of coverage. If you see yourself on the screen, let us know. We can definitely help you understand your options and again, understand who pays first. Next section is your responsibilities, and this is where I'm going to hand it off to my co-host, Karen.
Okay, Sarah, thanks so much for taking that part of the webinar. And I'll go on from here, talking a little bit about your responsibilities. If you could go to the next slide, please, Sarah. Thank you. So, excuse me, do I sign up for Part A and B? Let's take a look at this. If you're retiring at 65 and you're not already receiving Social Security benefits, you'll need to sign up with the Social Security office. The Social Security office handles enrollment for Medicare and issues your Medicare card. You can do this a variety of ways. You can go online and you'll see that link there, www.ssa.gov. You can call the 1-800 number that's listed. You can also call your local office. You can enroll over the phone, or you can call for a personal appointment at the Social Security office. As far as retiring after 65, in most cases, you don't need to do anything. Keep in mind, as long as your employer has over 20 employees, there are a few things that you can consider. You can continue working and keep your employer coverage, or you can continue working and drop your employer's health coverage, and go on to Medicare. It really all depends on what's best for you in your particular case. You can also consider enrolling in Part A. Enrolling in Medicare Part A costs you nothing. You're already entitled to that. And it also becomes a secondary payer to your health insurance, your employer's health insurance. So whatever coverages, whatever costs your employer coverage doesn't pay, your Part A will kick in and handle that as a secondary payer. So just crunch the numbers. Particularly keep in mind your prescription drug costs. If you're not on much in the way of prescriptions, that's not so much of a concern. But if you're on a number of prescriptions, you might want to pause and think about what would be best as far as your health insurance costs are concerned. Now, if there are under 20 employees where you work, you pretty much have to sign up for Medicare, as Medicare then will become your primary insurance and your employer coverage would become your secondary. Could we go on to the next slide, Sarah? Thank you. And now let's talk about Part D, creditable coverage. And again, Part D is your prescription drug plan. Be careful here because there's also a penalty involved if you don't sign up in the allotted time for a prescription drug plan. So again, if you're retiring at 65, get in touch with your employer's benefit coordinator and identify if your current coverage is considered creditable prescription drug coverage. If it's not, you may have to take out a standalone prescription drug plan. And that's something that you may have to consider in that case. Again, if you're retiring after 65 and you don't have retiree insurance, you'll have 3 months from the day you retire or your health insurance coverage ends to enroll in a standalone prescription drug plan if necessary. All right. So if you choose a Medicare supplement or Medigap plan, you'll need to remember that you'll have to have a separate prescription drug plan. Or if you select a Medicare Advantage plan, known as Part C, generally those plans will include your Part D. Not all of them, but pretty much all of them do include Part D coverage. If we could go to the next slide, Sarah. Thank you. And then also, let's just point out something about health savings accounts. In the event you have a health saving account with your employer, you should stop contributing to your health savings account at least 6 months before you apply for Medicare. You want to avoid any tax penalties on that. Reach out to the financial institution that houses your health savings account for more information. So between the financial institution and your benefit coordinator at work, you should be okay with that. Just be aware, cut that out, any contributions by at least 6 months prior to your retirement. And then the next slide, please, Sarah. The thing to remember too is, as far as Medicare is concerned, Medicare has no family plans, okay? When you go on to Medicare, they are all individual plans. So you need to think of how your spouse is covered. And are you the primary policy holder, or is your spouse the policy holder of your health insurance? All right. So identify your employer's coverage of your spouse if they are on your plan. Think about things like, what are the premiums for your employer's single health care plan or a family plan versus what's available through Medicare. Whoever is the policyholder must be actively employed. Otherwise, a penalty will be incurred for parts B and D. So another thing to consider is that you can, at 65, you can drop your employer health coverage for Medicare. And if you decide to do that, what about your spouse? Your spouse will need to find coverage until 65. So they will have to either go on to their employer's healthcare coverage, or they will have to find their own coverage in the marketplace until they in turn turn 65 themselves. If your spouse is continuing to work past your retirement and you have options under their policy, you may choose to have their employer coverage with no penalty. So again, there are
Hey, Karen, we lost sound there. Do we still have you? Karen?
Sarah. Oh, Sarah.
There you are. Welcome back. It's all right. We've got you. There are different options, just as Karen is saying, and there's a lot of different ways Medicare is obtained. So we're here to help. Karen, you want to go on to next steps?
Sure, Sarah. Thanks so much. I can do that.
Great.
So everyone, we know that considering going on to retirement and Medicare, it can be confusing. It can sometimes seem as though it's a daunting task, but that's okay. People are focused on other things. Sarah and Elizabeth and I, we do this full time, and we can help you work everything out. So don't be overly concerned. Just get to us in some time, and let us help identify what's best for you. So if you still have questions, make an appointment now. We'll be happy to talk to you. If you're feeling pretty good and you understand the next steps, if you're retiring within 6 months, start to work with your HR representative to understand your coverage and all the options that are available to you. And schedule an appointment with us 2 months out, and we can help you decide what Medicare plan is best for you to choose. If you're retiring outside of 6 months, work with us here at AAA to understand your timeline so you can know what to expect when you are ready. So I've had just a great time being able to explain a little bit of this to you. And if you have any questions, I hope that you'll reach out either to me or to Sarah. Sarah, do you have anything that you'd like to add?
Yes, I really appreciate you all joining us today. I want to say things change, and it's easier to plan for the unknown when you know what the goalposts are. Let Karen and I identify those for you. So thank you for choosing AAA for your Medicare information, and we look forward to hearing from you in the future.
Thanks so
Thanks,
much. Bye bye.